Kathy McHugh. I am an administrator. I'm also a registered nurse with a master's in administration and management, and I work at UroPartners Surgery Center in Des Plaines, Illinois. UroPartners, this surgery center was started in 2017. I did not come on board to 2019. So I only basically can speak from there forward. We are strictly urology. We do a little bit of pain because our head of anesthesia does some pain cases. We are owned by the surgeons. But with that being said, we became part of Solaris, which is a national urology group based out of Florida in February. Since I came on board, HST Pathways was the only thing we had. And then we joined Case Tabs, which eventually became, HST bought it and became Case Coordination. And, Pathways became Practice Management. So I have that. We have Case Coordination. We have eChart. It's been a little over a year that we had eChart. And last week, I just signed up to get Clarity, Comply, and the profit forecasting. They originally, prior to my arrival, they chose HST. They felt it was my COO, who I work with actually again, he's part of Solaris, that they felt it was really a good program for billing and the financial management of the center. So that was the original reason for going to HST. They thought it was a good product. They liked all the reports and what we could look at from the financial viewpoint. When we were on paper chart, it was a nightmare on so many levels. So when I started here, we were probably doing about 250 cases a month, and we had a tiny printer. We had a printer charts off of that kept breaking. So I actually sent out to one of the companies and had all our charts made and, brought in. That was a big expense that I had to keep doing. Patient stickers, all that. It just, every night you had to sticker every chart for the next day and make sure it was in the right order. That was all very time consuming, many hours to do that. The anesthesia portion, talking to the patients, it was all this documentation. The anesthesia record got passed around when we called the patient preoperatively. Then that information had to be given to whoever anesthesia wasn't called to review. It was all looking for someone to review it. So it was lots of hands, lots of time, people staying late, especially with prep of the charts. Because ironically, we're probably one of the only places where COVID helped our center, and we increased cases by about 25%. Because we did something called a lithotripter, we did their ESWAL procedures for kidney stones, and no one wanted to go to the hospital because they were too scared. So all these patients came here, and we have about 60 surgeons that come here from all the Northern Illinois. So it's a large group of surgeons that own it and bring all their patients. So all the various hospitals, everyone was too scared. So they came here. We still took care of our cancer patients. So we went from 250 to like 350 quickly, and we're still doing paper. And people are staying late, they're doing it was all this. So that's when it was like, we need to do eChart. And one of the things I fell in love with HST was they custom built our electronic record because we were just urology. Because a lot of ASCs do a lot of ortho, cataract. And since we didn't do anything, and they do very little urology in most surgery centers, at most maybe 5%. So we really needed a medical record, electronic medical record that met those needs. So we were the first live group that went down to Nashville post-COVID to build our chart. So that was really exciting. And we had 2 RNs and an analyst go down there and work on for 3 days building all the different blocks and creating our chart. So we were really very happy with that. Since we already had the financial platform with the practice management, and that's where we did all our scheduling, and we were happy with that product, it made sense just to go to the next level with the eChart. We did not want to go to another platform and start all over because we were happy with the product to that. In fact, even when I came on board, I had never used HST previously. Your company set up all these virtual meetings to help me run through it and learn it. I think the gentleman's name was Chris from California. A few times would get on to help me go through all the different parts of it so I understood it and could use all the different parts. One of the things also I love, as big as you are, it feels like, you're just in Chicago and you just have someone here for us. It's never like, oh, we're so busy, we can't, help you. So you really have done a wonderful job with that. When we had eChart, we had a really good nurse that came out here. She came out here for a couple of days to help institute it. So one of my huge worries was 60 doctors coming on different days in the month. You couldn't be here for 30 days every day. Her name was Kathleen. She helped train the trainer, so to speak, so the nurses knew how to help the doctors that weren't there in the beginning. Plus, we had our IT department support us with, one of the chronic issues still, the doctors forget their password. It isn't something just special to us, that's something across the board. But everybody's been very happy with it. It's just a few clicks and everything's done. We had already had case tabs on board prior to them becoming case coordination. So I think when we instituted case tabs, we did something that no other surgery center did, is we allowed, even though we had like 40 offices, we had them scheduled as one big office because we wanted each office, because when doctors would ask for a block time and couldn't have it, in the normal schedule, the other doctor would be blacked out, so they couldn't see that. We wanted the doctors to see that so they could start a conversation and say, hey, is it possible you can move up so I can fit in there, that sort of thing. So case tabs became HST, but it was seamless. The transition helped us do whatever we needed to do to make the product work. And some of the problems in the beginning was because we had 40 offices as one big office, there was a few glitches on that and how to fix that. And we troubleshoot it together and get it to work. My surgery scheduler is amazing and she really understands the HST product and she can troubleshoot and help the different offices do it. I love the hard stops. No one, if we don't have a CPT code, they can't put a reservation in. We need the CPT code. So then when it comes to billing and coding, everything, it just flows. The flow is amazing. And that's what I really like. And what made me decide to add these 3 new products, again, was the interfaces there. The hardest thing is the company we use to dictate our reports, that's a different interface. And it took IT forever, but having just everything under one umbrella makes it nice. So, you've always been there. We can call you, email you. I have emails of certain people that work for you, so I can reach out to them directly and not just to the general number. So there's lots of methods we have to, if we have an issue, to get things done. I think it's the ease of use. It's very intuitive. When we get registry nurses here, or we have student CRNAs that come in, it's so easy we bring our analysts over, we set them up, boom, 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 and there's no problem. It's just easy to use and it doesn't take long to train a new user on that. So that is really important. Whereas when we had paper, oh my goodness, you use this form, and then if you did this, you added this form. And here, everything's self-contained in the eChart. Really quick, it goes down, you finish yours. There's some nice hard stops that we wanted in place, so we know certain things got done before they move to the next level. So I really, really like that. The other thing I really love is all the automation. And this was especially important during COVID, all the patient text messaging we were able to do. That is huge. We send so many text messages. We have it all automated, set up. When on our case coordination board, when a patient moves from the pre-op into the OR, then the patient's family member gets a text saying they've now moved from pre-op into the OR. And why that's important for us, especially, our center is very, very small. We are too small even to have people come back into pre-op. It's really tight. So once COVID even ended, we felt it was safer for the patients not to have people, they say goodbye in the waiting room to their family and then come back. So that's why these messages are even extremely important, and they know when they come out of surgery, that sort of thing. So I really love the automation, and I really love your help department, because anytime there's a problem, we can just reach out like it's part of our company and reach out to them. I was fortunate enough to be able to hire somebody with a master's in informatics, and he has become our HST analyst here on site. He's, he doesn't work for you, he works for us, but he has learned everything he can. And then he's always learning every day to make it easier for us. Two things we're working on now is we're adding a transfer block when the patient, on a rare occasion, a couple times a year, patients get transferred via 911 to the hospital. So we're working on a block for that. And we're also looking at our chart completion rate to understand some of the nuances of that report and how we could customize it more for us. So those are the two things he's helping me with right now. But yeah, those are the three things I really like about HST. Streamlining our patient admission process. That's been absolutely huge with, not giving, 30 million papers for the patient to sit down to. So it's very quick. So that's huge. I'm able to pull reports that I can use in my board meetings to show the physicians how we've improved that, where we're improving on that. The financial reports are huge. Which doctors, give us the highest revenue. That's all from HST. It really, and it's not a manual process. It's all boom, boom, and done. You learn your reports as you're going. And then the other thing which I love is the ability to go in and print a whole chart. Like if an insurance company wants additional information, I just can go and click and send it to them. Not like in the olden days where you had to go pull the chart, take it out of the clip, scan it. So the automation, and it just, we're living in a faster and faster society that it just makes that easier. And it really helps a lot with quality. I'm able to pull up more reports on that as well. Revenue growth is definite. It's easy to compute, net revenue per case, all those things that before you had a system like HST, it was just an accountant sitting there and manually trying to figure it. So that's important. It's hard to say with staffing less because at the same time we're growing cases, but I do feel we staff less because I don't have as much admin staff as I did before. I have more clinical staff because we're getting busier, which is great. And we fit in more cases in a day because everything's quicker. Turnover's quicker. Because the doctors don't have to sit there and do all this written paperwork. It's click, 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 and they're done. So we are able to schedule more cases in a day. But we will be adding the Clarity, and Clarity is the one that helps us comply with the No Surprises Act. My surgery scheduler is the one in charge of sending the estimates, letters to the patients, snail mail. So she is overly excited that we're getting that so we can do patient estimates. We're doing Catalyst, and what I love about this, it's able to tell the patient what their out-of-pocket expense is going to be. And one of the reasons I could sell these products to my physicians is because we're coming on board with Solaris. There's so many changes in our revenue cycle department. We're kind of put on the side because they got all this new stuff that I can't get this information from the staff because they're working on so many new things. This way we're more self-reliant. So the patient can go in, he or she can figure out what their financial responsibility is. There's going to be a button for them to pay right there. I think I'm going to see, a better payment of what they owe. So I'm excited about that. And I really like the profit forecasting, which I can't wait to share with the surgeons on the cases they did and what profits they were anticipating we're going to make.